We recently published, an outcome study and resource utilization looking at large hemispheric infarct using real-world data. Often we look at those either through small pilot studies or through randomized clinical trials, but those have always been challenged with the number of patients that were recruited into these studies. And so we've actually looked at, an observational, although retrospective cohort of patients from in the U.S. From discharge databases. These were hospital drug databases, and we looked at the incidence of large hemispheric infarct and the management of these patients. So we had about 79,000 eligible patients or encounters that presented with ischemic stroke. And about 11,700 of these patients were assigned to possibly having a large hemispheric, infarct, and the rest were assigned to other potential ischemic stroke. And the most important finding is that patient who had obviously a large hemispheric infarct had a longer hospital stay. It was about 2.6 days longer. In addition, the cost was much higher, about $28,600 more. The significance of this is that large hemispheric infarct it could and does have a significant, cost associated with it, certainly poor outcome. And I think it's important as we're looking at these patients to think about early intervention. I mean, delaying potential surgery could have significant impact on outcome, but also financial. And so this is where factoring in patient wishes, certainly other comorbidities, and ultimately how their outcome is going to be important, just given the societal cost that's associated with this disease. And certainly now there are several trials trying to look at potential therapeutic option beyond the traditional surgical option, where we try to take this call out. And I think those will, if positive, will have a significant impact, just because they're easy to do, and you don't need to go to the operating room for a procedure, but they could have a significant financial and clinical outcome if positive. So I think the data certainly is the largest data set where we're looked at this disease in this context in a real life situation, and hopefully this would sort of help influence a little bit the maybe the nihilism in taking care of these patients, and try to approach them a little bit more aggressively early on in the disease.